Growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, it's Dr. Steve Rasner with another episode of The Lionhearted. Remember, you can contact me at drrasner at AOL. I love when you do that. So keep reaching out to me. It inspires me to keep doing these. Anybody that reached out to me, by the way, that asked me for something specific, and I didn't return, for some reason, an email, please rewrite to me. I mean, I'm a full-time dentist, just like you are. And sometimes I just forget. Things get by me. And so remember that. So at our last podcast, I ended it by telling you that you don't have to be a superstar to be a superstar in this profession. Meaning, it doesn't matter what happened to you in dental school. You can still kill it in this profession, and yours truly is living proof of this. That being said, I thought about what I said to you, and I didn't finish the second sentence. I said, you don't have to be a superstar to be a superstar. But I didn't tell you yet. You just have to be willing to outwork everyone else. Now, that doesn't mean long hours. That means investing in yourself for CE. And I will tell you, I finished that podcast by telling you what I used to do, and I still do. I mean, I'm talking to you right now in March of 2019. I'm taking off 4 days in April on an advanced bone grafting course down in Tampa, Florida. So I'm still doing what I've been doing for 30 plus years. First thing you got to answer is to yourself is, do you like this profession enough to do that? Because it is a big commitment. You know, I did a lecture 2 weeks ago on new dentist. And I always leave my number or my email for these guys, and several of them reached out to me. And some of them are not happy. And I mean, really not happy. And I get it. You new dentists have it way harder than we did. You have more debt. You have less opportunities. It's tough. But even those of you, some of them reached out to me that do have pretty good opportunities. Maybe they're in business, in the profession, they joined their father or a relative or something like that. And there's all kinds of struggles there because they can't implement the strategies that I'm talking about because they don't have full control. What I'm telling you this for is this. What I'm about to say to you will never, ever let you down. If you love dentistry, because if you don't love dentistry, then I'm not sure I would do what I'm about to tell you to do. You have to set up a program for the next 2 to 4 years. I mean, start with 2 and see if it changes you and your professional life the way I know it's going to. You can't just wish for this stuff. You can't just implement my management strategies that won't work for you if you don't have clinical excellence to go with it. You're hearing me? I'm going to say it again. You could have the greatest front desk team in the world, just like I teach you to. You could learn the verbiage to get patients to go out of network and try you, which means they're going to pay more out of their pocket, just like I do, and have those new bevy of patients. And you could have all the protocols that I talk about that lead to good relationships with your patients. But if you don't have clinical excellence, it's not going to last. You will not come close to achieving the success that I want you to have. So, look, I can imagine it must be impossible for you to want to do the things I'm asking you to do in terms of education if you're not into dentistry. And that requires a different conversation to me or a phone call to me. And I mean that when I'm sincere, when I tell you that I will communicate with you to try to help you if I can. I don't have all the answers. You're getting one person's opinion here. that's done pretty well in the profession that you and I share together. But the one thing that won't let you down, in my opinion, is education. But you can't go off half-cocked. You have to have a plan. What do you study first? And I've already told a lot of you, and very few of you asked me for it, my recommended residency starting right now. Like if you feel that, God, I'm just average, I'm just like any other dentist, I would tell you, to write to me at Dr. Rasner or AOL, and I will supply for you a residency based on various clinicians around the United States that I know. I know some out of the country too, by the way. You'd have to write to me for that. That can help you achieve, because you can't take everything, right? So just real briefly, what would I do? I would visit the Spear Institute if you were in the United States, and I would take the different courses he has. I mean, every course he has, in my opinion, is worth taking, but you can't take them all in 1 year. There's too many. So just for material choices, when to use what, treating the worn dentition, I absolutely would go to the Spear Institute. Treatment planning is another strength of his and that organization. And believe, I haven't talked to Frank Spear in 10 years probably, but I know a lot of people that go there, and I went to his office something like, I went to Seattle with it's either him or John Coy's 22 times in the 90s. So that's a good basis. So, and I look back before I did this podcast over a couple of my days of the last week. And I'm just going to, if you'll put up with me for a minute, these were the skill sets I was employing to have these very good days. This is Thursday of a day in my office. I started my day with an uncovery of 6 maxillary implants that I did, of course. And as you already know, I have encouraged you to consider strongly, I'm going to come back to this, the triad of skills of oral sedation, atraumatic extractions, and site development for implants, and then surgical implant dentistry. Those 3. Oral sedation, atraumatic extractions, along with site development, which means bone grafting. And thirdly, surgical and prosthetic implant dentistry. My patients on this day were an uncovery of 6. That was a $45,000 case, by the way. It was a maxillary and a mandibular bar overdenture case. I removed all his teeth, and we had a final. We're not done. The second patient was a single implant only. The third patient was full extractions except 2 teeth, and I put them in a provisional partial denture. By the way, the first patient had an hour and a half, the second patient an hour and a half, the third patient 2.5 hours. And think about those days. And along with that, now my next patient was a post-op for a free gingival graft around a prior implant, a suture removal, another free gingival graft. And my last patient of the day, I want you to hear this because I want you to know what these days are like. I think it helps you. At least I hope it helps you. The last patient of that day, of the day I just gave you, was a patient that's come to me for 38 years. He's about 78. And he had a root canal done. I referred him to an endodontist. Molar root canal is not my strength, but that's a very good skill for you to become dedicated to in the next couple years if you don't want to do surgical implant or extractions. And he had an endo. I referred him to an endodontist, and he clearly needed a new crown. I mean, there was no doubt about it. He didn't have decay, but he needed a new crown. And he wouldn't do it. Remember, in one of my last episodes, I said, you have to be a chameleon. And This is a patient that is just stone cold thrifty. How's that for me being nice? And he's a great guy. He shows up for office. He doesn't break appointments. He has nothing fancy in his mouth. He has a full dentition. He has no missing teeth. But he has pretty large, he probably has amalgams. I can't remember right now. I assure you, he has large composites that should be crowns. And I couldn't even get him to have a crown, so I just did a core. After doing all that sophisticated dentistry on this given day, yes, we also did a core on a tooth that had root canal at another office that really needed a crown. And I want you to hear that. And why I'm telling you that, I want to tell you about my February. Because those of you that heard my podcast in January heard me telling you what I was killing it in January. And I was. We had a record-setting January. And I remember saying, I don't know what February or March is going to be like. But when I said that to you, I thought they were going to be really good. That's the God's honest truth. And I'm telling you this because I want you to know what happens to me too. My February was horrific. Down a lot of money from the February before. My January was tops. Tremendous. Record setting. Which is hard to do in January, as you know. We're coming off the holidays. Everybody just spent a lot of money. And yet, February comes, balloon. Not good. Now, why? Because I didn't have the three things I told you that you need. And those three things are, I had a lack of new patients. No work was funneling off that nucleus I tell you that you need to build with your practice. And either I got a lack of new patients or I had new patients that did not see the value. So let me give you some examples. And I'm telling you this because I don't want you to think for 1 second that when I achieve those 4 million plus years where I do over $4 million, that every month or every week is just record setting. It's not. But if you stick to the guns I'm giving you, if you stick to the philosophy that I've been sharing for the last 3 months, all I can tell you is that at one point I had 29 years in a row of continual growth and profitability, meaning I never went down. If that happened to you right now, you would almost make it to 2050. Think about that. I think I figured it out once. You would get to 2049. I think that's correct from now. Without having one off year where I was not even down $5 during those 29 years. Using the philosophy I'm giving you. The exact same philosophy. So that's a pretty good record. But it doesn't mean every month is good. But you do need the ingredients that I've been giving you. And I had patients, I can think of a couple in the month of February that I thought were going to be slam dunks. What do I mean? At the new patient exam, the patient showed up with the significant other. That is always a positive for me. Was fearful, had not been to a dentist in years, was missing teeth in the aesthetic zone, which can be good and bad, by the way. It's good if it's recent, and that makes them highly motivated. It's bad if they've been like that for years and they're just getting around to doing something. And here's the thing. There's two cases that I'm thinking about. I want you to picture this in your head. And most of the teeth missing or that would be lost were going to be in the aesthetic zone. And both of these patients told me that they were severe gaggers. And any removable that they had prior to my office ended with failure. So how could I be any better? They're coming with a significant other. They heard good things about us. They weren't coming to me because it was a discount ad that I was giving a free consult for this or that, or I was discounting my fees in the month of whatever, February, because I don't do that. And I treatment plan fixed, because there's nothing better than that kind of patient when they still have the teeth present that they're going to lose. Why? Because they have the bone present for implants. That's why. And I treatment planned fixed implant replacement on both of them. And it was expensive. It was north of $20,000 on both of them. Not because I wanted it to be. I don't never want it to be a lot of money. It is what it is. And gone. I didn't even get a chance to give them a plan B, which would have been hard, by the way, because I had all those parameters against me. They're gaggers. They want fixed. It was too long of a span to be a bridge. And the reason I'm telling you that is that was a part of my February. And for whatever reason, these things tend to trend together, just so in that case, I never even got with those patients to see if they qualified for patient financing to afford the work that they needed. I never even got that far. When they heard the fee, it was pretty much over. So I kind of am telling you that on purpose because I remember thinking how great I was in January and God, everything I tell you works. And it does work, but not every week, not every month. But over the course of the years, yes, indeed, it'll come around. So back to that you don't have to be a superstar to be a superstar, but you do have to be willing to dedicate yourself to the needed skill set. Because I promise you this, I would never have big days. I would never have big months or big years if I didn't have the skill set that I have. And so I want to share that with you once again and how it is so relevant, in my opinion, to your success. And I know I've covered this in earlier podcasts, but I don't think you can hear it enough. Because I know for a fact the great majority of you listening right now will not take the next step that's required. You won't call up your state board of dentistry, or if you're in a foreign country, find out from the Commonwealth that regulates the dental board agreements there what you need to do to prescribe the 3 drugs of Benadryl, Atarax, and Triazolam and nitrous oxide, which is my sedation cocktail. I mean, if you think about it for a minute, that's not even a skill. What's the skill in giving a patient 3 pills and hooking them up to gas? There's no learning curve whatsoever. You're as good as I am the very first time you administer it. What you need is permission from your governing body to deliver that. And that requires, in most places in the United States, 60 hours of education. And if it was 100 hours, I would take it. If I was in a state that made me get an IV, which some of them do, an IV sedation license to prescribe just pills, and I understand why they do that, because they are in a different state of consciousness when you give the drugs I just told you. Those of you who don't know what I'm talking about, write to me, and you'll get emailed my protocol on my oral sedation protocol of Atarax, Benadryl, Triazolam, and gas. From A to Z, I give you everything you need to have. And you have to follow the safety precautions. It's not you just give anybody the drugs. I've never had an incident, as you've heard me say on these podcasts, in 22 years of doing this. But I got to tell you, if you're going to do the skills that I want you to train for, to follow my blueprint, and that would be pretty much any extraction except third molar extractions. I'm not a big advocate of those. But any other tooth, broken to the gum, full mouth extractions, yes, I'm totally on board with that. Bone grafting is a skill that takes a while to master. And there are many voices on how you should do what and where should you apply which type of allograft or autogenous bone or mixed. How do you build lateral width on a edentulous mandible in the posterior or maxilla? How do you build vertical bone? I mean, this is not a thing you learn. I mean, taking teeth out, you can learn quite quickly. Bone grafting sockets, you can learn quite quickly. Even grafting dehiscences in the buccal wall, yes, that can be done quite nicely on a weekend. But other grafting techniques can take years to master, just like soft tissue augmentation as well. Okay? So the cool thing about you guys, most of you, is that you're all getting started at such an earlier age than most of my contemporaries. I mean, I didn't even start implant training to my mid-40s. And let me make this clear about implant training. That is a forever commitment. That is not, oh, I only got to do this for 2 years and I have it down. Nope. That's a forever commitment. But it's a fun commitment. Oh my God, the first time you ever do an implant, you're not even going to feel like you're a dentist anymore. You're going to feel like they should call you something else. I'm serious. And it opens up the avenue in your office. And one thing I'm convinced of, patients aren't impressed, at least the patients in my history of 39 years, are not impressed when you refer them out for other things. They actually like it for you to be a jack of many trades. Now, if you're going to be a jack of many trades, my philosophy is that you got to be really, really good at what you were going to send them out for, which is why I don't do molar endo. It's why I'm very, very comfortable with any extraction, bone grafting, and for that matter, sinus lifts and implant dentistry. But I could go over schedule after schedule, and I did it before I came on the air tonight. And I will tell you that the way I have those big days is because I incorporated these skills. And by the way, I didn't even talk about how much more interesting that makes your days. And when you have a sedation practice, oh, let me just say one thing. If you're going to do these skills, you almost have to sedate them, because you will not do a sound job on a patient that is anxious and uptight because they're not sedated. So don't let them talk you out of it. And if you have a patient that really needs sedation and for whatever reason they're not going to let you do it, then refer them out. Don't do them. You know, I don't want to come across as a crackpot here. You need to know, none of you have taken my courses, my in-office courses where I teach atraumatic extractions. I teach bone grafting, and I teach implants. But in those courses, I almost always have ASA 1 and ASA 2 patients, which means they're basically healthy. That's who I'm sedating as well. I never sedate children. I don't really, I mean, I obviously know how to take third molars out. Took one out today, but it's not the general theme of my practice services. And I don't think it should be yours, because there's no return on value for the risk of doing a lower third molar. Because the incidence of paresthesia or the incidence of excessive bleeding or a mistake and the complications around that, as far as I'm concerned, are too high for the reward of taking the tooth out, or to be quite frank with you, for the money that you get paid to take a third molar out. So I don't want you to think you're listening to somebody, anything goes, and I do whatever comes down my office, and that's why I do these numbers. That wouldn't be the case a little bit. I refer out a lot, and I'm not afraid to tell a patient that may not be medically sound that they need to have that done in an environment, in a hospital setting, or at an oral surgeon's office, or somewhere where they're prepared in the case of a complication. And I think that's absolutely the philosophy you should find. But I told you the numbers. You're already familiar with the numbers I do each year. Well, that's based on that patient population base that I'm giving you. So the skill set that I'm really trying to get you to invest in would be, and I would combine them. Look, you also have to treatment plan your life. You're going to make a big mistake if you just dedicate your entire next 5 years to the profession, forget your wife or your significant other, and then end up really skillful in a healthy practice that you have to give half away to the spouse that's divorcing you because you didn't pay attention to that part of your life. I know this is all complicated to put it all in balance. That's why I'm talking to you. That's why I'm trying to help you avoid the mistakes that I made, a lot of them. Like spending lots of money because I was making lots of money. So I know most of you younger dentists don't want to hear, I get it, about saving money, but just Google the power of saving early in life and look for yourself. Don't take my word for it. If there's any way you could have the discipline that I did not have, I'm fine, but I could have been a lot more fine. Had I applied the principles that I'm trying to get you to follow about putting a little money away each year. What's a little money? I don't know, $2,500 to $5,000 a year, as young as you can, and never touch it. Oh my God. I won't be around when you're celebrating, but you'll be a happy, happy person by the time you're in your 50s. So again, getting back to how are we going to make this happen? Be sure, again, you write to me. You have my email. Ask me for my recommended residency, or ask me what you're about to take. If I don't know, I'll tell you I don't know. Now, in terms of the triad I'm talking about, let me just make it clear before I end this podcast. Oral sedation is going to be the courses that your state or your governing body of your license mandates that you take. In most states in America, it's 60 hours of CE to get the permit to prescribe more than one drug. If you follow my protocol, I'll give you the whole protocol from A to Z. That doesn't give you the permit. You have to go to the state and take whatever courses they approve. You know, it'll be CPR, you'll get 5 credits for that. Pharmacological reviews, things like this. I don't know if you need advanced life support training in most states, but I'll repeat, it would not matter what my state of New Jersey mandated. If they said I had to do an IV training to maintain my permit, I'd do it. It's too powerful in every possible way. Number one, and not enough time left on the podcast, but you are going to, you know I like to keep it real. So I'm not going to make up statistics that don't exist. I'm going to tell you that it'll impact your practice within 6 months. You know why? Because most of your colleagues in the community that you're in will not do what I'm telling you to do. So you will be unique. Unless you're willing to commit a crime and give these drugs without having a permit, then you will be very unique in your community. And guess what you can do? You can market the heck out of that skill set. There's no other skill set, and it's not even a skill set. It's a permit, really. There's no other skill set you can market like that. None. Not root canal? What are you going to say? I'm the best root canal person in town? The talk of root canal scares your patients. So no, you can't do that. So understand, that's really up to the governing body of your license, wherever you're at. Number 2, atraumatic extractions. Google the dental profession. I give a course that's 2 days, 4 times a year in New Jersey. You don't need a license in New Jersey to take my course. You can write to me or write to Beth, and she will give you the details. They're usually sold out because I only limit it to a maximum of 10 doctors because I kind of control the whole thing. I have assistants a little bit, but it's 90 minutes each day of lecture, and you're into the real deal with me right next to you, guiding you along the way. And that's for extractions, and I have some doctors that have repeated it 4 times because I can tailor it to whatever you want it to be because I can do that with only 10 doctors. And then learning implant training, you'll have to write to me and I will give you my recommendations because today you have abundant good choices all across the United States and out of the country as well. And I do know doctors across the world that are great instructors. I think at the University of Hong Kong is Nick Matthias. He has an incredible program there. Nick Crumpus, I'm messing up your name, Nick, sorry, in Greece. So I know people pretty much everywhere that can help you with this, including myself. I'm not here to sell you. I'm here to help you and give you a road. But again, I repeat, I would combine my curriculum, and I'll give it to you in writing if you write to me, to tell you, like I'll tell you where to learn materials, where I would go to treat the worn dentition or occlusion, etc. So what's coming up on my next couple podcasts would be, I'm going to revisit the next level for you on case acceptance. The things that should be in your mind when you are walking into the room, the invisible signals about a patient in front of you that should dictate how you approach that patient. Things I'm sure most of you don't think about. And I'll also eventually have my first guest, which will be my new patient coordinator, my financial coordinator of 38 years, Michelle, who will help you with the verbiage. And that's when you should show your new patient coordinator and your financial coordinator of how we get people to come out of network on a constant basis to our office, which means they get reimbursed less. What's the truth that we tell them and still get them to come to us? How does she help us get paid up front? What's the verbiage for that? How to get the significant other to come to the initial appointment when they have a lot of need. Things that you need to know. Hey, I'm hoping you have a great day. I've enjoyed doing this. I hope it's helping some of you. See you at my next Lionhearted. Dr. Steve Rasner.